My name is Boswin Kafano, and I'm here to inform you about the safety practices in churches during COVID-19 pandemic. Ever since onset the COVID-19 pandemic, we fall all the disadvantage effect that the globe was forced to address interrupt normally. It has been over a year since the COVID-19 pandemic virus was discovered. I have noted that many of us are still uneducated about how deadly this virus is, causing the surging death and the new strains the virus that are emerging. I admit that all of you were worried and scared about the pandemic. As my fellow community members, I have been trained as a nurse. I'm apprehend that is why I'm telling you as a community and church that we all need to be concerned. I believe that all of you agree that prevention is better than cure, especially during challenging and strategic time history where we are all at risk of contracting the COVID-19 virus. However, all hope is not lost as we can be sure of health safety if as a community the worship together. You follow the World Health Organization safety regulation concerning COVID-19. As a trained nurse, I will provide you with informative that will play as essential role in preventing COVID-19 infection and death. According to Vinny Paul Kremlin, maintaining social distance in public places that are crowded is one significant way of controlling COVID-19. Same as you know, some of you may not be aware, but we are required to maintain a distance of 6 feet apart from each other. I humbly request that we adhere to this guideline right away and give your neighbor a distance of 1.5 meters before we can continue. Thank you. Additionally, some of us do not understand why it is necessary to have social distancing, and I will gladly explain the necessity. As part of social distancing, my duty as a nurse is working with the health ministry to focus on minimizing the number of cases from other regions in our community. The first step is by sanitizing quarantine all passengers gaining entry to the country within the first 2 weeks of the first confirmed cases, and then by progressively implementing a contacting tracing system. As a community, you need to monitor and track down those who have come into touch with a known COVID-19 patient in society. The purpose of contact tracing aims to locate and isolate new patients to prevent infection transmission. We urge you as health workers to be cooperative and adhere to safety regulation of COVID-19 prevention by maintaining social distance. I'm aware that COVID-19 situation is a significant source of concern throughout the world. Many of us have witnessed how individuals with pain-sensitive syndromes affected by the pandemic may have worsening physical and mental symptoms. We are continuing to work as health workers in the front line to find solutions by educating the public on how life changes caused by the coronavirus contributed to emotional distress in people diagnosed with chronic central sensitization pain addressed through treatment and counseling. Thank you.